It feels like we've just started to breathe a sigh of relief with COVID kind of fading from the headlines.
Yeah.
But there's another health threat
Right.
that's got experts worried, and it's spreading quickly.
Yeah,
So are you ready to take a deep dive into mpox with me?
absolutely. I'm always ready. It's interesting because mpox,
Mm-hmm.
which I think some people might remember as monkeypox,
Right.
it's not really a new disease.
Right. It's been around for a while, but it's the surge in cases and deaths
Yeah,
that's got everybody on edge.
absolutely.
The Africa CDC is calling it a serious situation.
Mm-hmm.
Over 1,100 deaths
Wow.
and 48,000 cases just since January of this year.
This year alone.
And
Yeah.
they're saying if we don't get a handle on this,
Right.
mpox could actually become even worse than the COVID-19 pandemic.
What's concerning is just the potential for this to escalate quickly.
Right.
Just look at how mpox has spread to Mauritius,
Right.
the place that a lot of people think of for its beautiful beaches and tourism.
Definitely makes it feel a little closer to home.
Yeah.
Makes me a little uneasy, too, because I was literally just looking at pictures of the beaches online the other day.
Oh, wow.
The Africa CDC has been really direct about the lack of funding to fight mpox.
Mm-hmm.
What kind of impact could that have?
Lack of funding is a huge problem.
Yeah.
It means fewer resources for testing, contact tracing,
Right.
and treatment. But what's really concerning is the impact on vaccination programs.
Right.
Without enough funding, we really risk falling behind in the fight against mpox and just letting it spread unchecked.
So how exactly is mpox spread?
So mpox is a zoonotic disease,
Okay.
which means it can jump from animals to humans.
Got it.
And this usually happens through contact with infected animals,
Okay.
like rodents or primates. But it can also spread from human to human.
So if someone comes into contact with an infected person,
Mm-hmm.
what are the risks? How does that actually happen?
Primarily through close physical contact. We're talking skin-to-skin contact, coming into contact with bodily fluids from an infected person,
Right.
or even touching contaminated materials,
Oh, wow.
like bedding.
So it can live on surfaces, too.
Yes.
You mentioned that there are two main subtypes of mpox.
Yes.
Could you break those down for us a little bit?
Of course. So we have clade 1 and clade 2.
Okay.
Historically, clade 1 has been mainly found in Central Africa.
Okay.
So if you were planning a trip to that region, you'd be more likely to encounter clade 1.
Okay.
On the other hand, if you were traveling outside of Africa, you might be exposed to clade 2.
And this is where things get a little bit more complicated, right?
Exactly.
Because we're now seeing the clade 1b variant
Yes.
popping up in places like the UK,
Mm-hmm.
Sweden, and Germany.
Exactly. And this new variant highlights just how adaptable the virus is.
It seems like Central Africa is being hit especially hard by this outbreak.
Unfortunately, that's true. They're seeing the majority of cases and deaths. The Democratic Republic of Congo in particular has become the epicenter.
Wow.
And they've actually launched a vaccination drive to try and get ahead of it.
It's good.
It's a good step, but the sheer scale of this outbreak really demands a global response. It can't be tackled by one country alone, and that kind of brings us back to that critical issue of funding.
Yeah.
The DRC is making a commendable effort, but it really underscores the disparity in resources.
Yeah.
A lot of countries in Africa, especially those hardest hit by mpox, just don't have the money or the infrastructure to really mount a strong defense against an outbreak like this.
It's a scary thought.
Yeah.
So what does all this mean for someone listening to this?
Right.
Like, should we be worried?
I don't think worry is very productive, but awareness is.
Sure.
I think we need to understand how mpox spreads
Okay.
and the risks involved.
Yeah.
But just as important is knowing what steps we can take to protect ourselves.
Okay.
It's also a good idea to stay informed about travel advisories and any recommendations from health authorities.
So let's dive into those preventative measures.
Sure.
What can people do to protect themselves?
Avoiding close contact with anyone who is infected is really important.
Okay.
We talked about skin-to-skin contact,
Right.
bodily fluids, and even things like bedding.
Right.
Good hygiene,
Okay.
like washing your hands frequently,
Okay.
is also key. And of course, vaccination plays a huge role in prevention,
Yeah.
although access is still a challenge in many parts of the world.
Healthcare workers are really on the front lines of this.
Mhm.
What kind of precautions should they be taking?
Absolutely. They need to be extra cautious and follow strict infection control protocols.
Okay.
That includes wearing personal protective equipment,
Yeah.
like gloves, masks, and gowns when dealing with anyone suspected of having mpox.
Right.
And proper handling and disposal of contaminated materials is crucial to stop the spread.
So it's a lot to process.
It is.
I think it's easy to feel overwhelmed when we hear about these emerging health threats.
Yeah.
It's almost like again.
I understand that feeling, but knowledge really is power.
Yeah.
The more we learn about mpox,
Mhm.
the better we can protect ourselves and our communities.
It really seems like this needs to be a global effort.
There's no question about it.
Yeah.
This isn't something any single country can handle alone.
Right.
We need international collaboration on research surveillance, sharing resources,
Mhm.
and getting consistent public health messages out there.
Yeah.
That's how we'll effectively combat mpox and prevent it from turning into a full-blown pandemic.
The COVID-19 pandemic definitely taught us some tough lessons
Yeah.
about being prepared for global health crises.
It certainly did. We saw firsthand the devastating consequences of delayed responses and not having enough resources.
Right.
I think the mpox outbreak is a chance to learn from our mistakes
Yeah.
and take proactive steps to prevent a repeat of history.
So what are some of the key things that we should be advocating for on a global scale?
I think the most urgent need is more funding for research, surveillance and containment efforts.
Right.
This includes supporting the development and distribution of vaccines, especially in heavily affected regions like Africa.
Right.
We also need to strengthen healthcare systems in lower-income countries,
Right.
so they have the capacity to detect, diagnose, and treat mpox effectively.
And what about public awareness?
Yeah.
Seems like that could make a big difference.
Public awareness is absolutely critical.
Right.
People need to know the symptoms of mpox,
Right.
how it spreads, and what they can do to protect themselves.
Mhm.
That means clear, accurate information from sources they can trust,
Yeah.
delivered through all kinds of channels.
Right.
Social media, public service announcements,
Yeah.
community outreach, you name it.
It feels like with everything else going on in the world,
Right.
a threat like mpox could easily get lost in the noise.
That's a real danger.
Yeah.
We're constantly bombarded with information, and it's easy to become numb to news about outbreaks.
Right.
But that kind of complacency can be dangerous.
Yeah.
When it comes to global health threats,
Yeah.
we need to stay vigilant.
Right.
And remember, we all have a part to play.
So just to recap, we're dealing with mpox,
Right.
a potentially serious global health threat that's hitting Africa the hardest,
Yes,
and there's not enough funding to contain it.
that's a good summary.
Yeah.
And I think the key takeaway here
Yeah.
is that global health is interconnected.
Right.
What happens in one part of the world
Mhm.
can absolutely impact us all.
So where do we go from here?
Right.
What can our listeners do with all this information?
That's the big question, isn't it? I think this deep dive has hopefully given you a better understanding of the mpox situation.
Right.
But the real question is, what will you do with this knowledge?
Right.
How will you be part of the solution?
Yeah.
Will you speak up for increased funding for global health initiatives?
Mhm.
Will you educate yourself and others about mpox?
Right.
Will you challenge misinformation and complacency? I think the choices we make, both individually and as a global community, will determine the course of this outbreak and future ones as well.
That's definitely something to think about.
Yeah.
Like a powerful reminder that we all have a role to play in protecting global health.